A trial of the Oxford-AstraZeneca vaccine on children has been partly suspended while scientists investigate a possible link with rare blood clots in adults. The University of Oxford has told the BBC that there are no safety concerns with the trial itself, but that scientists were waiting for further information. The medicines regulator, the MHRA, is reviewing some rare cases of thrombosis that have been reported in adults who have been vaccinated. Parents and children are being told to continue to attend all of their scheduled visits, and the Prime Minister Boris Johnson has urged people to get their vaccination when invited to reduce, he says, the risk of a third wave of infections. Our medical editor Fergus Walsh has the story.
Nearly 300 children aged 6 to 17 are taking part in the AstraZeneca vaccine trial in England, which began in February. Oxford University said there'd been no blood clots in the volunteers, but out of an abundance of caution, it had stopped vaccinations pending the outcome of the safety review in adults. More than 18 million people in the UK have received the AstraZeneca vaccine. The MHRA said last week there'd been 30 rare cases of blood clots, including 7 deaths.
So it's nice to see whether the air is sterile?
Yes. The Prime Minister, visiting an AstraZeneca plant in Macclesfield, once again gave his firm support for the vaccine.
The best thing people should do is look at what the MHRA say, our independent regulator. That's why we have them. That's why they're independent. And their advice to people is to keep going out there, get your jab, get your second jab.
As a precautionary measure, the MHRA updated its advice last month to say that anyone with a headache that lasted for more than 4 days after receiving the AstraZeneca vaccine or bruising beyond the site of the jab should seek medical attention.
Both of the vaccines we're using are highly effective against COVID, and the risks of getting sick or dying of COVID for all the people currently being offered first and second doses are far and away greater than any small theoretical risk that may exist relating to these cases, which are extremely rare.
As for the future course of the epidemic here, 3 academic groups modelling the outbreak all have multiple scenarios showing a third COVID wave after a final lifting of restrictions in England in late June. This model from Warwick University looks at the number of patients in hospital with COVID, which have been falling fast since a peak in January. Looking ahead, the assumption is the reopening of shops and outdoor hospitality won't cause major problems for the NHS. But once all restrictions are lifted, a third wave follows, though likely much smaller than previous peaks. But it could be more or less severe, depending on how effective vaccines are at preventing COVID and stopping transmission. A seasonal drop in coronavirus could push that third wave well into the autumn.
As we start to unlock, I suspect we may see the R number increasing and we may see another wave. My hope is it'll be a somewhat different wave and we can keep hospital admissions and deaths relatively low. And I think that's the really crucial thing, that if we can do that, then hopefully we're still on track with the roadmap to release restrictions towards the end of June.
The AstraZeneca vaccine is central to the huge success of the rollout of jabs in the UK, which is way ahead of the rest of Europe. France has restricted the AstraZeneca vaccine to adults over 55, Germany to those over 60, because of concerns about blood clots in younger adults. The European Medicines Agency and the UK regulator are due to give updated recommendations in the next day or two. Maintaining public confidence in this highly effective vaccine will be vital.
Let's pick up then on that confidence point with Fergus, who's with me now. People might be understandably alarmed, Fergus, to talk of this partial suspension. What exactly are we talking about?
So the Oxford scientists have told me tonight that this is being done out of an abundance of caution. There are no safety concerns in the volunteers. They simply thought it would be sensible to stop vaccinating while this adult review was going on. Now, no medicine, whether it's paracetamol or vaccines, is risk-free, but unpicking whether there's a link between the AstraZeneca jab and these incredibly rare blood clots is frankly difficult. Now, the incidence in the UK is thought to be about one case in every 600,000 vaccinations. In Germany, it's higher, nearly all there involving younger women. And each case has to be investigated. Did those involved have underlying conditions? Did they have COVID, which increases your risk of clots? And is there a connection between them? Now, we know that there's an all too real risk from COVID, especially among the elderly. For those in their 40s, for example, there's a 1 in 1,000 risk of dying from COVID after infection. Now, it's a much lower risk in your 20s and 30s, which means that balance of benefit versus risk is more balanced. Now, regulators have said now that in all age groups, the benefits of the vaccine greatly outweigh the risk. But remember, Huw, this is a global vaccine. 2 billion doses of the AstraZeneca jab are being produced. So this is going to play a vital role in bringing the pandemic under control this year.
Indeed, Fergus, thanks very much again. Fergus Walsh, our medical editor, with his latest analysis for us there.